Ready for the big meeting?
Yeah. Hello? A meeting? It's a big one.
Yep, too bad we're double booked. Diarrhea and abdominal pain.
You may know it from those mildly embarrassing TV ads.
When my IBS flares up, it's a sharp pain like a punch to my stomach.
But Linda Bonanno knows it from daily life. She has struggled with IBS, irritable bowel syndrome, for 2 decades.
It's horrible. Sometimes I could be fast asleep and wake up out of a dead sleep at 6 in the morning and just keel over in pain.
Desperate for relief, she immediately signed up for a study at Boston's Beth Israel Deaconess Medical Center.
I made an appointment and I went down there.
She came home with fingers crossed and a 3-week supply of pills. The results seemed miraculous.
As the days went on, after a week, I kept feeling better and better. Now I'm thinking, what's in this?
So what was the special something in those pills? It was, drum roll, absolutely nothing. Linda was taking placebos, like these, with no real medication in them at all. What makes her story even more astonishing? Linda was told she was taking placebos.
I remember the first day I took it, I said, why am I even taking this? You know, it's like a waste of my time. But when I saw that I felt better, I'm thinking, well, maybe he just told me it was a placebo, and it's a new medication they're trying out and didn't want me to know.
Ted Kapchuk, a professor at Harvard Medical School, ran the experiment. What did your colleagues initially think?
Oh, everyone thought I was crazy at the beginning of it.
But it worked. He says roughly 60% of the subjects in his study reported getting better, even though they knew they were taking a placebo.
A placebo is an inert substance, usually something like cellulose, starch, sugar. Placebo effect is actually everything that surrounds that pill. The interaction between patient, doctor, or nurse, it's the symbols, it's the rituals. Those are powerful forces.
Doctors have understood the power of placebos, at least since they were used in clinical trials in the 50s. But fake pills work only in certain cases.
There are a lot of illnesses you don't give placebos for, cancer or lowering cholesterol. Basically, the scope where a placebo effect is relevant is any symptom that the brain can modulate by itself.
In those cases, just making an appointment, going to a doctor, and taking a pill suggests something may happen.
About 35% of the time, people will report some symptomatic relief from taking a substance that is not biologically active.
That's quite a
People
bit.
will, yeah, it's very impressive.
Dr. Arthur Barsky is a psychiatrist at Brigham and Women's Hospital in Boston. He says people even report side effects from placebos. Clearly, we are highly suggestible creatures.
And there's some studies with, for example, with asthma. You can provoke an asthmatic attack by showing someone a pollen that they're allergic to, but it's in a sealed jar. I had a patient who had allergic dermatitis to cats, and she saw a cat on a television set, on a screen television program, and started to itch.
Aware of the power of the mind, as many as half of all American doctors admit to having prescribed some form of placebo, according to a 2008 study.
There are a lot of things that we do that aren't directly curative that make a difference. Prescribing vitamin pills, iron pills, cold packs, heat packs, giving antibiotics for a viral infection because the patient really wants it.
And it's not just that the patient imagines feeling better.
People who responded to placebo treatment who were in pain, we actually see part of the pain matrix being activated that would change the sensation of pain.
Just the act of taking a pill, even a fake one, can coax the brain into producing its own helpful chemicals.
In fact, we know that giving the pill in the context of a healthcare encounter activates neurotransmitters.
Something chemically is happening. That's amazing to me.
It's really amazing to me, and I've been in this business a long time.
I know that the phenomenon of my patients changing by virtue of nothing else than their expectations is real.
Neurologist Alberto Espe at the University of Cincinnati specializes in Parkinson's disease. Drugs used in Parkinson's help the brain make dopamine. Turns out, placebos do too. And this can be measured objectively, measurable changes within the brain.
very much so.
Depression comes with Parkinson's, and you can really sink pretty fast if you let yourself.
Bob Walton has lived with Parkinson's for more than a decade. Dr. Espy enrolled him in a study supposedly comparing an expensive drug to a cheaper one.
But I actually felt a little better after I got the expensive one.
Well, guess what?
He did an interview with me at about an hour and a half after it was over with, and he said they were both saline solutions.
These were both placebos.
Both were placebos.
And of course, there was no price difference at all. And so we have twice as much improvement if I think it cost a lot.
Exactly.
Not only did the supposedly expensive drug do twice the job, it did just as well as a real Parkinson's drug. So they thought that because it was expensive, it has to be good.
Correct.
And that alone can affect things physiologically.
It does.
The lesson here, says Dr. Espy, when patients believe in their medications, those medications just may work better. Now, to do your experiment, you had to mislead people.
I did.
How did you feel about that?
Terrible.
In fact, outside of clinical trials like Dr. Espy's, the American Medical Association frowns on deception in treating patients.
Patients cannot be given a placebo without informed consent and told clearly, transparently what it is.
But given Linda Bonanno's success with placebos for her IBS, it may not matter if patients know, which raises an interesting question.
I think the next step is, how do we concretely use placebo effects in clinical practice?
There are some ways in which we might be able to not deceive the patient, but still get the benefit. You tell the patient, we're going to give you the active medicine, but on some days you're going to get a placebo. And if that were to work, you would then lessen the chance of addiction, tolerance. It's cheaper.
Meanwhile, Linda's symptoms are back full force. But she has an appointment with Professor Kapchuk.
And I'm possibly going to go on placebos again and see what happens. And
It seems so strange to hear somebody say, I'm going on placebos.
I know.
It's like
I know.
saying, I'm about to start taking nothing again.
Exactly.
I'm really excited.
Yeah.